Professional English in Use, Chapter 13. The Overseas Doctor Types of Registration. To manage and treat patients in the UK, all doctors must register with the General Medical Council, GMC. There are several types of registration. Provisional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area, EEA, member states. Full registration is for doctors who have completed their year's clinical training. Limited registration is for international medical graduates who have not completed the equivalent of a year's clinical training in the UK. Specialist registration is for doctors who have completed specialist medical training and have a certificate of completion of training, CCT. The GP register is a register of all those eligible to work in general practice in the NHS. PLAB. Before they can obtain full registration, some categories of overseas doctors are required. To take the Professional and Linguistic Assessment Board, PLAB test, PLAB is designed to ensure those who pass can practice safely at the level of SHO in a first appointment. In a UK hospital, Part 1 consists of a written test of knowledge, skills, and attitudes. Part 2 is an objective structure clinical examination, OSCE. It consists of 16 5-minute clinical scenarios, known as stations, to assess professional skills. PLAB stations and advice. OSCES assessment assess these skills. Clinical examination. Your ability to carry out a physical examination or a simulated patient, an actor trained to play this role, will be assessed. Uncomfortable or intimate examination will be carried out using a mannequin and anatomical model. Practical skills. You will be assessed on practical skills such as suturing and giving intravenous injections. Communication skills. Your ability to interact with simulated patients, or in some cases, the examiner will be assessed. Skills tested may include breaking bad news and giving advice of lifestyle. History taken. Your ability to take an accurate history and make a recent diagnosis will be assessed. Advice on the stations from a successful candidate. Read the instructions outside each station carefully. You have 1 minute for this. Don't forget the ABC airways breathing circulation protocol in every emergency station. Keep in mind safety precautions like throwing the sharp in the sharp bin. Check the patient understands what is happening. Then ask them about any concerns they may have. Don't just give a lecture. Listen carefully to what to what the actor says. No, charts are needles and blades which must be disposed of safely in a special container called a charts bin. Exercises. 13.1. What kind of registration might these doctors obtain? Look at A, opposite to help you. A newly qualified Spanish doctor, provisional registration. A newly qualified Nigerian doctor, limited registration. A doctor who has successfully completed the first foundation year, F1, FY1, for full registration. An ASHO who has successfully completed the foundation program and gained a certificate of completion of training after several specialist registrar posts, specialist registration. 2. Write the abbreviations in words. Look at A, B, and C opposite to help you. Any doctor who wants to work in the UK must register with the GMC, General Medical Council. Some overseas doctors must pass the PLAB test before they can register. Professional and Linguistic Assessment Board. Part 2 of the test consists of a OSCE, Objective and Structured Clinical Examination. In any emergency, remember the ABC protocol: airways, breathing, and circulation. Before you can obtain a specialist registration, you must have a CCT, Certificate of Completion of Training. Complete the test. Look at A, B, and C opposite to help you. My name's Musa, and I come from Yemen. I came to the UK about 2 years ago after graduating because Yemen is outside the EEA. I could only obtain limited registration with the GNC at first. It was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the PLAB test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be that at counseling stations, you shouldn't simply memorize a set of phrases. It's better to really think about what you're saying to the actor, and get the intonation right. After completing my year's clinical training, I was able to obtain full registration, but I found it difficult to get an SHO post in my chosen specialty, pediatrics, as hospitals now have to demonstrate there isn't a suitable candidate from the EEA. Once I've completed my second foundation year, I should obtain a CCT, which will allow me to proceed to completion of training with the GNC, an important step on the road to becoming a pediatrician consultant.